Well, thanks for coming this afternoon. We're going to talk about, is your food making you sick? First of all, we're going to look at a brief history of food, especially as it pertains to what we're talking about today. So, the genetics of who we are very much set by our ancestors. What they ate for 20,000 years sometimes is very much responsible for the kind of bodies. First of all, let's define that. What is a food allergy? It is technically an immune system reaction of two different categories. The first is what we call an allergy. The second is an intolerance. An allergy is an IgE, immunoglobulin produced by the immune system in response to food within 2 hours, an immediate onset. It's actually called an immediate onset hypersensitivity reaction. For example, peanuts creating an anaphylactic response where the throat swells up, shellfish causing breakout as a rash. These are the most dramatic forms. It can also be sinus congestion by eating wheat, or phlegm in the lungs when you eat dairy. So, what are the ways that we can test? We're going to talk about a couple in particular, but this is a brief overview. There's what we call an elimination challenge process. We're going to talk more about that. And then all kinds of professional testing, from skin tests. These are your classic skin scratch tests that an allergist would do. Fine for identifying immediate onset reactions. There's blood testing, which is technically the serum, where the cells are removed. Finger stick testing, like somebody who has diabetes would be doing to check insulin every day. Saliva. Sublingual, where they give you drops under the tongue of an antigen and watch for a reaction. And then kinesiology. For example, one big one is Candida. Okay, this is a yeast that is a normal member of the intestinal system. It's part of our normal flora in a certain amount. However, Candida overgrowth can be a major underlying factor in the reaction to foods. Candida is just an opportunist. It takes an advantage of a scenario like antibiotics that knock out the competition, the good gut bugs, chemical exposure, oral birth control, corticosteroids. These are some examples that can deplete the good gut bugs, and lead to dysbiosis, which is simply an imbalance in the gut. When that happens, you can get an overgrowth in the gut as well. Okay, so what can we expect with changing these foods? Elimination of reactive foods, or minimization, right, leads to relief or total remediation of, now these are just common symptoms. Digestive problems, that's number one up there for a reason. Migraines, and these are, by the way, all from my practice. Chronic headaches, arthritic pain, chronic fatigue. Okay, there's also something we call a classic triad that's very common in kids, directly related to foods. Children frequently present with, number one, a skin rash, number two, ear infections, and number three, asthma, or a history of all of these in their past. Very common is this story. Child starts eating wheat. Parents don't know. Rash comes about. They keep eating more wheat. The rash will disappear, and quite often the ear infections will start. Okay? Now we're moving to deeper organ systems. If they continue to eat wheat, the ear infections disappear and asthma comes about. If you remove the child from wheat at that point, the asthma goes away. Guess what comes back? Ear infections. Ear infections clear, the rash comes back. Right, so the question is there a common treatment for Candida? And yes, first of all, there's a common conventional treatment. That's known as diflucan. But the issue with diflucan, this is a medication, is that it is a sledgehammer type of effect on the Candida. I mentioned briefly in my talk that Candida contains something like 62 known toxins to the human body. Guess what gets released as soon as you kill off Candida immediately? All of those toxins. If you go in there and obliterate Candida, which you can do, they all get released at once, and we call this a die-off reaction. It's actually